Basic tracheostomy care by Ward A2. Setting up suction pressure. Turn on suction machine. Adjust suction pressure to 20 kPa. Clamp suction tubing and adjust suction pressure again. Adjust suction pressure in between 20 to 30 kPa. Suctioning. Apply clean gloves after doing hand hygiene. Attach suction catheter to the suction tubing. Remove oxygen mask or HME if applicable. Apply sterile gloves to your dominant hand. Using your non-sterile hand, hold the suction tubing whilst your dominant hand can hold the sterile part of the suction catheter. Gently insert suction catheter into tracheostomy until 10 cm or when resistance is met. Apply negative pressure to start suctioning. Gently pull the suction catheter. Discard the suction catheter by wrapping it on the sterile gloves. Dispose on clinical waste bin and put the oxygen back. Use sterile water to clean suction tubing and perform hand hygiene. Document the procedure and update care bundle. Changing inner cannula. Perform hand hygiene and apply clean gloves. Make sure to put the inner tube in a tray covered with a sterile gauze. Remove oxygen if applicable. Hold the base to minimise movement on the tracheostomy and gently rotate the inner tube counterclockwise until you feel a click. Pull the inner cannula out. Replace the inner cannula with a clean one. Insert the inner cannula and rotate clockwise. Place the oxygen back and document the procedure. Cleaning the inner cannula. Prepare the equipment as listed below. Perform hand hygiene and put clean gloves on. Clean the inner cannula by using a sterile water and cotton swab. Keep in a tray with sterile gauze to keep the inner cannula clean. Changing tracheostomy dressing. Prepare equipment as listed below. Perform hand hygiene and apply clean gloves. Open sterile pack, maintaining aseptic non-touch technique. This procedure always requires 2 people, one person to clean and one person to hold the tracheostomy in place. Remove oxygen mask. Apply sterile gloves. Clean the wound using the cotton applicator. Remove tracheostomy collar and thoroughly clean the wound surrounding. Dry the wound using a sterile cotton swab. Apply the new dressing one side at a time. Make sure the silver side is facing the patient's skin, as this methylene dressing has silver that promotes wound healing. Secure tracheostomy collar. Place oxygen back when necessary and document the procedure. Update wound care plan and tracheostomy care bundle. Checking tracheostomy cuff pressure. Using a sphygmomanometer, measure the existing pressure of the cuff. Gently inflate the cuff, achieving pressure between 22 to 32 mmHg. Disconnect the sphygmomanometer from the port. The balloon port indicates that the cuff is inflated. Proceed in aspirating the subglottic port by using a non-Luer lock 20mm syringe. Connect the syringe to the subglottic port and aspirate gently. Document the amount in the care bundle and discard the syringe. Update tracheostomy care plan. Applying speaking valve or HME. You will be asked to change oxygen mask to HME or the speaking valve when appropriate as part of the weaning process. Never put a speaking valve when the cuff is still inflated. Deflate the cuff until the balloon is flat. Remove oxygen and apply HME or speaking valve. Check patient's oxygen saturation after 5 minutes and continue to monitor the patient. Document the procedure. Things to remember. Always get informed consent from the patient and explain the procedure to be done. Maintain patient's dignity and privacy. Document the procedure in the nursing care plan and care bundle. Follow trust guidelines and policy.